Can I change the shape of my lower eyelid? I would like to know if it's possible to change the shape of the lower eyelid. I added a photo that shows two shapes of the lower eyelid. The eyelids of the eyes on top is the way I look now, and on the bottom is the shape I would like to achieve. I'm not sure if a lateral canthoplasty and or a procedure called the lateral tarsal strip would help me.
Thank you for your question. You submitted two sets of photos and you're asking, can you change the shape of your lower eyelid? And it's clear you've been doing research. You're using terms like lateral canthoplasty and lateral tarsal strip to see if it's possible to achieve the shape you want. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. A significant part of my practice is enhancing lower eyelids as well as restoring, in terms of reconstruction, complications of cosmetic surgery to affecting lower eyelids. So I can give you some guidance as to the possibility, but in the absence of a physical exam, it is a limited, limiting my ability to give you a full answer. But I can explain to you a few things that you should understand before undergoing any procedure. So to begin with, you have to ask yourself, what is it about this change, which appears to be approximately 1 to 2 millimeters, with a lower eyelid, instead of being slightly rounded or a natural curve, which is probably your natural anatomy, you want to bring the eyelid up a couple of millimeters. The question you have to ask yourself is, will there be a significant enough improvement that can justify this type of surgery? From the limited photos, I would probably expect that you are younger, and you have to understand some of the other elements of what it means to operate on someone who is younger. But let's begin first with anatomy. And what are the elements of the anatomy that affect the position of the lower eyelids? Well, to begin with, let's start with the bone structure. The bone structure is the framework which the lower eyelid is attached. And it's attached by a medial and lateral canthal tendon. Now, the framework is also affected by the relative position of the eyeball and the soft tissue of the orbit and the soft tissue within the eye socket. So when you think of these single procedures, what you're describing as doing something to pull the eyelid in a way that would try to create this level position, I don't think it's likely to happen when you do those types of procedures. Sometimes you can get some improvement, but you have to also take into account the other elements of the anatomy. There are three main elements of the anatomy that's very important to understand. There's the lateral canthal tendon, which is the tendon that attaches the lower eyelid to the inside of the outer aspect of the eye, of the orbit. There's the posterior lamella, or the tissue behind the eyelid, and there's the anterior lamella, the tissue in front, or the skin and the muscle. Now those three elements work together. So when people come to me who have complications of cosmetic eyelid surgery, I very often have to do surgery to address all three elements in order to restore proper position. Now that being understood, you have to ask yourself, and when you do a consultation with a specialist like myself, what of those elements do you have to do in addition to try to achieve this? And a lot of times you can probably not need additional skin in the front, but you do need something in the lower eyelid on the inside. That is typically some type of graft material. Now when you say the word graft, it means that your body also has to provide it with a blood supply. So you could hear that this is now getting a little bit more complicated. And when you have variables like this, it makes the procedure less predictable, and there is always room for some degree of asymmetry. So it's not just surgical skill, because surgical skill can achieve a certain look on the table, but then the body has to heal in a way that is consistent and predictable. And that being said, you can understand when we're dealing with fractions of millimeters and with the relative specificity in what kind of outcome you want, you have to factor those variables in before you move forward with surgery. It's important to understand that once you do these types of operations, they can't be fully undone. And so it's a big commitment to consider something like this for a limited improvement. So a lot of times when people come to me with this type of situation, once I explain this, and they tend not to want to do that because they think originally it was just a simple little tightening procedure. But those simple little tightening procedures don't work long term. Sometimes you can get maybe 1 or 2 millimeters by releasing something called the lower eyelid retractors, but in order to kind of figure that out, you have to have a physical exam. So it is important that you actually meet with specialists like myself, oculofacial plastic surgeons, particularly those who focus significantly on cosmetic surgery, and it's a small number. And once you have the information, you have to make a very difficult decision on whether or not you're willing to accept the possibility of the asymmetries and the possible need for additional surgeries. Revision surgery is part of cosmetic surgery. It's never 100% avoidable. All specialists perform revision surgery. It's just part of the deal that the human body heals in a way that may or may not be the way we want. So with that being said, I hope that was helpful. I wish you the best of luck, and thank you for your question.